Hi, I'm Dr. Linda Eckert, and I wrote this book called Enough Because We Can Stop Cervical Cancer. And the reason I wrote this book is I just got tired of watching women die of a preventable cancer. You know, we have prevention, we have screening, we have treatment, but what we don't really have is access for all women to be able to use those different tools we have to prevent cervical cancer. So this is a story that collects the voices of women from around the world, from 6 continents, who has cervical cancer, and through their words, I talk about why this preventable cancer is not being prevented. But most importantly, I also talk about what we can do about it. This is a book that could be used by all individuals. It is written for non-medical personnel, but as a physician myself of 31 years, I learned so much talking to these individuals and researching for this book. And so I do think medical providers will learn something when they read this book, but I also hope that the general population would learn something and want to then become engaged in helping to prevent these needless deaths. You know, women are the backbone of our society. They work, they raise children, they care for elderly, they run countless organizations. And without mothers, without wives, without parents, children don't do as well. And so I really feel like if we can prevent deaths of women, we can offer great benefit to our society. One of the most inspirational facts for me about this book was the incredible stories of people from all over the world. People who have suffered from cervical cancer have shown incredible resilience and compassion and really advocacy, and want to get the word out there and want to work toward elimination of cervical cancer. The World Health Organization has declared cervical cancer an elimination strategy. They want it gone. And that's because we have the tools to make it gone. But how can we use these tools better? How can people avail themselves out of these tools? And why aren't we using them? And that was another reason why I just wanted to write this book, was to get these stories out there and to help educate and advocate for saving lives from a preventable cancer.
This is a global epidemic, and it's more prevalent outside of the U.S. I feel
9 out of 10 cases
9 out of 10
are in low income settings.
That is just mind-blowing.
And
heartbreaking.
There's no screening in most parts of the world, and no vaccine. So
I guess I feel pretty lucky.
well, I have a lot of spots in the book that talk about the equity challenges. And there are equity challenges in our country. This is a cancer of inequity.
Absolutely.
Cervical cancer is a cancer of inequity. I don't know that people really know that.
No.
At least not in this country.
No.
My colleagues don't know that. My colleagues don't know that if you live in Nigeria, you cannot get an HPV vaccine because it's not in the country. If you live many places, you don't have access to it.
When you're diagnosed with anything HPV related, people just automatically think sexually transmitted disease. It's your fault. You were promiscuous. And then all of that is just, and when it comes from family, it's worse.
So painful.
It was. It really was. And so I said, you know what? I'll turn it around.
There isn't a single person I talked to for this book in 6 continents that didn't talk about the stigma and how hard it is when you tell someone you have cervical cancer, and the assumptions that and the terrible things people say, and the judgment, versus the idea that, if you have sex, you're going to catch HPV, because 80% plus of adults will get it. And I think one of the other survivors, she told me once, I was just unlucky. Mine stuck around. It didn't go away. Whereas, 80% of the time they go away. So I just think that if this book does anything, I really hope it's just one more piece
Yes.
of
I hope so
trying
too.
to eliminate some of the
I
stigma.
hope so too, because you have women who, because of the stigma, they won't come out.
Yeah, they won't
They
get
won't come
treated.
out.
They won't tell anyone. They won't go to the doctor.
And that's sad.
Yeah.
That's sad.
I chose to tell my story in your book because when I was diagnosed, I was so humiliated and ashamed by my diagnosis that I couldn't talk about it publicly. And I led a really public professional life. I would present in meetings, I would present at conferences, I was very comfortable on stage. And all of a sudden, I felt nothing but shame and silence. And it took me a year to get comfortable talking about cervical cancer and to say it without any change in my intonation, to say it strongly and proudly that I had cervical cancer and that I had survived. And I think similar to a lot of what we see in the conversations that we've been having this weekend, that's a really common phenomena. And I couldn't find another woman in my professional network who talked about cervical health or cervical cancer at all. But I knew individually that many of us had had abnormal paths, some sort of intervention or treatment, but no one was talking about it. And so I viewed my story as the opportunity to tell one woman's story of this disease, what it did to me, what it did to my family, and what I want for the women of the world in the aftermath of surviving this preventable disease.
I mean, I have a lot of hopes for this book, but one of the biggest hopes is that it just can normalize talking about the cervix, talking about HPV, talking about this preventable cancer that is increasing in prevalence. And why is that? And why can't we change that? And what else do we need to do? So that was why I wrote this book. I just felt these stories need to be out there. This conversation needs to be more common.
Absolutely. And when we think about cervical cancer, we often get tripped up in the nuance and the layers of complexity. It's a cancer that's caused by a virus. It's sexually transmitted. That's very simple. But each of those pieces carries its own weight. And culturally, we are not comfortable talking about these things.
Yeah.
But we're talking about a virus. And if COVID taught us anything, these conversations in public health are really critical to the future of our societies and our communities. And when we can't talk about them, women die and communities and society suffer.
I would just encourage, if you're a cervical cancer patient or survivor, family member, caregiver, colleague, ally, whatever you want to call yourself, if you have a passion for spreading awareness or sharing your story, to do so, because you have so much power to make change happen, and you're not alone in it, because there's a large community out there that wants the same thing, and that's to end cervical cancer once and for all.
You are not alone. You don't ever have to be alone. There's an entire community out there who are willing to stand and fight and thrive with you, for you, alongside you. You should not be embarrassed. It's not your fault.
I'm so excited about Dr. Linda Eckert's book, Enough. As a longtime cervical cancer survivor, I am excited that the powerful stories of not only those who've experienced cervical cancer, but what the world needs to know why we should eliminate cervical cancer is going to be on so many different platforms. We want people talking about cervical cancer because this is a cancer that shouldn't be killing people, but unfortunately, people are still dying of cervical cancer. So this book is a personal narrative for so many of us who've experienced cervical cancer firsthand, but it also is a call to action that we've had enough, that we can eliminate cervical cancer.